purpose of this training is to provide you with a technique to increase desirable behaviors in older adults with neurocognitive disorder. Undesirable behaviors, or behaviors that you would like to occur less often, are likely to be challenging and disruptive for those around the older adult. When an older adult has neurocognitive disorder, their communication becomes impaired, and they are likely to engage in undesirable behaviors as a way to communicate their wants and needs. These behaviors are likely to produce an outcome that the older adult is unable to ask for. For instance, an older adult may throw items on the floor. When this behavior occurs, it is natural for us to approach the older adult and provide some amount of attention. In the future, the older adult is more likely to continue throwing items on the floor and receive attention. Desirable behaviors are appropriate behaviors that we want to see occur more often. It is likely that if desirable behaviors are not occurring as often as you would like, it is because they have likely not produced the outcome like the undesirable behaviors have. It is natural for us not to attend to desirable behaviors because they are not disruptive. When we do not attend to desirable behaviors, however, we will see more undesirable behaviors. If we attend to the desirable behaviors, though, we can expect to see the desirable behaviors increase and undesirable behaviors decrease. We first need to identify the setting in which the undesirable behavior is occurring and identify the desirable behaviors. Let us walk through the following scenario. An older adult is waiting for dinner at the table and the caregiver is setting the table. Dinner is usually at 5 p.m., but it is 5:10 and dinner still has not been served. As the older adult awaits, she begins to engage in undesirable behaviors. The caregiver does not attend to the older adult's yelling. The caregiver does not approach the older adult until the screaming stops. Once the undesirable behavior stops, the caregiver will provide high-quality attention.
Here you go. What's your favorite food? Do you like pasta? Yeah. What's your favorite kind of pasta?
After attending to the appropriate behavior multiple times, the yelling should begin to decrease and waiting patiently should begin to increase. Let us show you how to use the same technique during a care task.
Hi, Minyoung. Would you like to join me and do an activity outside? It's a little chilly, so we'll have to wear a jacket. Which jacket would you like to wear? The white one? That's a great choice. Can you stand up so we can put on your jacket? All right, let's put your first arm through the jacket.
No. No, 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 no.
Now let's put our arm through the jacket. Nice job. Let's try your other arm. Perfect. This is a good jacket. It looks good on you.
To overcome this, we suggest repeating key words several times. Repeat your sentences exactly and allow enough time for the older adult to respond.
Hi, Sydney. Are you hungry? Are you hungry?
Yeah.
All right, well, let's see what we have here. So we have some cereal for you to eat, and then we have some water as well.
It is likely that you have encountered a situation in which you had a difficult time helping an older adult transition to a new task or activity. To help facilitate a transition, you can provide continuity in the conversation by continuing the same topic of conversation and to slowly introduce the upcoming task or activity.
Hi, Sydney. What are you coloring?
A zoo.
Oh, that's really cool. Have you ever been to a zoo?
Yeah, a long time ago.
What were your favorite animals to see?
I like the penguins.
Have you seen the lions get fed during lunch?
Mm-hmm.
Yeah, that's always really fun to see. Are you getting hungry?
Yeah.
It's almost time for lunch.
What are we having?
We're having sandwiches and some chips and salad. But we can color for a few more minutes and then we should probably go to lunch.
Okay.
Would that be okay?
Mm-hmm.
Cool, we'll do that.
It is also likely that you have encountered a situation in which an older adult misused a word or had difficulty finding the correct word. We can help the older adult become unstuck by suggesting the word that they are looking for. When they say the incorrect word, you may repeat their sentence with the correct word or ask, "Did you mean?" and provide a suggestion for the word they are attempting to use.
Would you like to turn the page? Perfect.
Look at that bush.
Oh yeah, look at that tree.
We should ask structured questions during our interactions by asking closed-ended questions, which allow older adults to simply say yes or no.
Hi Sydney, would you like to go to the activity room?
Yeah.
All right, let's go.
We may also structure our questions so that 2 items are presented and the older adult selects one of the options. After a selection, be sure to provide the items selected.
Hi Sydney, would you like to do an activity?
Yeah.
All right, I have a book or a card game we could play. Which one would you like?
Card game.
All right, let's go ahead and deal these cards out.
Older adults, regardless of their memory impairment, benefit from positive interactions with others. However, with memory impairment, they may have difficulty in initiating conversations. When we use the exchange technique, we can make the interaction fun and provide high-quality attention. You can make your interactions engaging when you smile, laugh, and ensure that you are providing enough time to respond when it is their turn to interact. You should also initiate the conversation with a conversation topic that interests them.
Hi Sydney, what picture are you looking at?
It's a picnic table.
Oh wow, have you ever been on a picnic?
Yeah, I used to go on them all the time. Have you?
I have. What are your favorite foods to bring on a picnic?
I like chips and sandwiches and pop.
Older adults may have a difficult time understanding what you are saying. When we use the direct technique, we can help facilitate the older adult's understanding by using short, simple, and direct statements. We can also use specific nouns rather than pronouns or referring to items as this or that.
All right, Sydney, it's your turn. Should we match the blue 3 with the blue 6?
Sure.
Perfect. I'll match my blue 9 with the blue 3. Now it's your turn. What card should we put on the blue 9?
Blue 2?
Yeah, let's put the blue 2 on the blue 9. Perfect.
By using this communication strategy, we can help facilitate the conversation with older adults and increase the quality of our interactions.